who are my colleagues. And through your star students and present star consultants like Dr. Varalakshmi. Over to Dr. Pasha.
Respected Shaik and dear friends. Good morning all of you. Thank you for your kind introduction, sir. Topic like stroke trials in 2023. As we all know, it's really hectic to complete in 15 minutes. We'll just have a overview what has happened in the 2023 regarding the acute ischemic stroke. Yeah, in the next couple of minutes we'll go through this topic, stroke trials. Because in this 12 to 15 minutes it's quite impossible to have an in-depth discussion. We'll just have an overview. So we'll have a glance how we are going to manage the acute ischemic stroke and what is already known to us about this. And what are the headliners in the stroke trials in 2023. So basically, how we are going to manage this acute ischemic stroke. We all know that the time is brain and we are more focused on the penumbra. When a patient presents to us with large vessel occlusions, depending upon the presentation and depending upon the evaluation, we'll just plan about how we are going to manage. Is it if the patient presents with less than 4.5 hours, if you are going to have an intravenous thrombolysis, and if the patient presents with less than 6 hours, shall we go ahead with thrombolysis or should we have an added component of endovascular therapy? Considering this aspect score, where the patient is having even less than 24 hours also, there we are going to have a better outcome with endovascular therapy. This point has been focused in 2023 regarding the management of the acute ischemic stroke. They are more focused on this endovascular therapy. So what we are already known is, when there is a large vessel occlusion, like internal carotid artery as well as the M1 branch of MCA territory, when the patient presents to us within 6 hours with an NHS scores of more than 6 and aspect score of more than 6, the studies have shown that there is improved outcome with endovascular therapy. Then what happens when the patient presents with aspect 6, less than 6? That has been focused in the 2023. There have been 3 trials which are tried about this, like select, angel aspect and tension. Just we'll have an overview about all these trials. Regarding this select 2, this is been done with Saraj et al., who has studied, which is international and which has done in 31 sites, which is a phase 3 randomized trial, which is studied in 352 patients who have been affected with this large vessel occlusion with an aspect score of 3 to 5. Yeah, I think we are having the postgraduates here also. May I know what exactly is aspect score? So because when you consider when the patient presents to us with an ischemic insult, so when you have a non-contrast CD, so it is the ability to detect the early ischemic changes. So you will be having, if you take the slide at the basal ganglia level, scan at the basal ganglia level, you will be having 7 points here. These are the ischemic zones. And if you go above that level, we are having 3 points. So this at the MCA territory level, we are having 10 points for this aspect score. If that, how are you going to diagnose that this patient has been affected early ischemic changes? So one is, there will be a reduced attenuation. The second point will be, there is a loss of gray-white differentiation, and third point will be, focal swelling will be there in the sides. So if you can diagnose that area area has been affected. So altogether we have 10 areas constituting 10 points. So if each point is affected, you are going to remove that point from there. That means if the patient is having 8 points, around 8 to, it has been divided like if the patient is having 8 to 10 points of aspects, you say that there is a small core of ischemic zones. If the patient is having 6 to 7 aspects core, you can say that the patient is having a moderately core of ischemic zone, less perfusion. And if the patient is having an aspect score of 0 to 5, it concludes that there is a large, in fact, a large core is affected. So which is good? Is it 8 to 10 is good or less than 5 is good? Regarding this aspect. Yes, obviously the 8 to 10 is good and 0 to 5 is bad. So in that bad patient, these studies has been done. There's all the 3 studies has been done in the aspect score where they are having a 3 to 5. This study has been randomized. Out of 352, the randomized is 178 patients with the endovascular therapy along with the standard medical treatment. And the remaining 174 patients has been given the standard medical treatment. They focus on the primary outcome like efficacy at 90 days. They have been studying the efficacy by following this modified Rankin scale. Modified Rankin scale means if it is 0, if it is less number, then no better, no symptoms. If it is having a more number, they are having the bad outcomes. So by following this modified Rankin scales, what they shown was, study shown was, the endovascular therapy has been showing a better outcome, better efficacy at the 90 days. The same, coming to the secondary outcomes, regarding their study regarding functional independence at the 90 days. They compared the thrombotic group with metabolic group. What they found was the thrombotic group is having the more functional independence at the 90 days. And coming to the safety outcomes, they have been having a procedural insults of 18%. So coming to this outcomes, they have studied the symptomatic intracerebral hemorrhage within 24 hours after stroke onset as well as death from any cause within the 90 days. They are having no significance between these two groups. Coming to the limitation of this self-study, it has been terminated early because of efficacy, potentially leading to the overestimation of the effects of thrombectomy. And also, only 20% of the patient has received the thrombolytics before randomization. So to conclude, the patient who has been affected with large vessel occlusions with a large ischemic core volume, the endovascular thrombectomy in addition to the standard medical care has resulted in better functional outcome but at the 90 days. But it has been associated with procedural vascular complications. So coming to the second study, which is an angel aspect study, which has been studied with XO in China. It's a multicentric randomized study which has studied in 456 patients which have been concluded with this large vessel occlusions having an aspect score of 3 to 5. Again, the patient has been randomized to 230 patients for the endovascular therapy as well as standard medical care and 225 patients with the only standard medical care. So what they concluded was the primary outcome same regarding the efficacy at the 90 days. They have shown that endovascular therapy is better. And coming to this secondary outcome, the safety outcome within 48 hours of randomization regarding the symptom, they have studied regarding the symptomatic intracranial hemorrhage as well as any intracranial hemorrhage. What this data shows is in both this endovascular group, this complication is higher when compared to the only medical treatment group. So this limitation is less than 1/3 of patients has received this intravenous thrombolysis, and instead of some patients, instead of multiplex, they received urokinase, and more than 80 years patient has been excluded. To conclude this study, who has been included with large vessel occlusion in the anterior circulation, the endovascular therapy within 24 hours after stroke onset resulted in better functional outcome at 90 days. But more intracranial hemorrhages has been documented in when compared to medical management alone. Coming to the third trial, which is a tension trial. Here the Martin and al. Has studied this, which is a prospective randomized multicenter trial, which has studied in 253 patients who has been affected with large vessel occlusion with an aspect score of 3 to 5. They are randomized into 125 patients with the two around endovascular therapy plus medical treatment, and in case of 128 patient given only the standard medical treatment. So coming to this primary outcome, same, the efficacy at 90 days has been shown as a better in case of endovascular therapy. And coming to the safety outcomes, here what the studies have shown is because of this endovascular therapy, there is a decrease in mortality. And regarding the symptomatic intracranial hemorrhage, there is no significant difference between this endovascular group as well as the medical group. To conclude, this endovascular thrombectomy was associated with improved functional outcome and lower mortality in patients with acute ischemic stroke. So all these three trials, including this Rescue Japan trial. This Rescue Japan trial is a 2022. They have done in 2022, which is the basic for this endovascular therapy. It has shown there is improvement with the endovascular therapy. On building of this, all this trial has been initiated. They have done this. Lina et al. Has done this research and meta-analysis regarding all these three studies. What they have analyzed was the analysis of efficacy outcome at 3 months has been done. What they found was that they found that there is a reduced disability which favors the endovascular therapy, and there is an independent ambulation which are seen by modified Rankin scale of 0 to 3, which has favored the endovascular therapy, and there is good functional outcome which has been again favored the endovascular therapy. But coming to this, there is a excellent functional outcome in both of this, best medical treatment as well as the endovascular therapy. And the second analysis was done for regarding the safety outcome at 3 months. What they concluded was there is a symptomatic ICH which favors this best medical treatment, and also any ICH which is favoring this best medical treatment. What they have concluded was but at 3 months the mortality is not showing any difference between these two groups. So to conclude, this what they concluded was the endovascular therapy is safe and they have to be considered in the large core acute ischemic stroke. To sum up, in 2023, new sciences in 2023 demonstrated the advanced neurointerventions can benefit a broader array of patients with acute ischemic stroke. The current meta-analysis provides the promising results with this endovascular therapy, saying that it is safe and effective and may be considered in everyday clinical practice in patients with large core acute ischemic stroke, as assessed by the aspect score of 2 to 5 or volumetric methods. In future, the future perspective is you have to see there is a need of lot of prospective multicenter trial and comparing this trial with endovascular treatment in consideration regarding this late windows as well as the major block and lesser aspect score. Questions at the end.